Starwood Equine is a full-service equine ambulatory practice with locations in Woodside, California, and in the East Bay. We pride ourselves in providing comprehensive veterinary care and health management services for your equine partner and athlete. Thank you for accessing our online educational resources. Check back often as we will continue to update the site.
Maybe. There we go. So here's an introduction. This is the Starwood team. I think you guys all know us, but hi, I'm Cara. And I grew up on the East Coast. I swam, I evented, went to college, went to grad school, went to vet school, moved all around, and now I live in California. Let's get started. We're going to start with normal physical exam and then go through some of the basic emergencies. Colic, which is obviously a big one, choke, eyeballs, lameness, and lacerations. So that's a super important number to know, that basically anything over 101.5 is considered a fever in a horse. Obviously, keep in mind if you just finished riding and it's hot, or your horse has 2 blankets on and it's 65 degrees or whatever, use your judgment. But in general, that is the range. Heart rate is normal 28 to 44, and respirations are 12 to 16. So my pro tip for checking respiratory rate in a horse would be to watch the sides of their abdomen and don't watch their nostrils, because they will always be sniffing at stuff and that will mess up your count. So the other thing about all of this is to just know what is normal for your horses. Some horses are always going to run in the 99s or have a heart rate in the 30s or whatever, but knowing what is normal for them is the key for you when something is different, to know like, hey, I need to take a closer look at this. Some of the other things that we check for on a normal physical exam would be mucous membrane color and capillary refill. Their gums should be nice and pink. They should not be purple, gray, bright red, any sort of color of that nature. Know your horse's appetite and know their normal behaviors, so that if you see something that's a little off from their normal, you are paying attention. Okay, so we're going to go on and talk a little bit about colic, which we sort of had that poll question up, which was, which of the following organs can cause colic pain? And the question, or the answer, was all of the above. So the answer is, colic is a really broad term that just means abdominal pain. So anything basically that causes pain in the horse from their chest back to their tail could be considered colic. The equine GI tract is really, really long, so there's a lot of places that things can happen. There we go. There's a picture. So this is obviously not to scale, but this is just to show you some of the different organs. So esophagus, stomach, small intestine goes forever and ever and ever. Then there's a cecum, which is the big vat where they ferment stuff, and then it goes into the large colon. So lots of places where things can go awry. Stomach, the most common thing that we see are gastric ulcers, which are caused from acid. Small intestine, lots of weird things. Large intestine, other weird things. The most common ones, and doctors obviously tell me what you think, but I think we see the most gas colic, so just kind of crampy, gassy, and mild impactions, which are basically your horse maybe didn't drink enough and then his manure is a little hard and he's a little uncomfortable. Hi, Gary. So now we have all 5 Starwood doctors. Awesome. And then cecum, which is the big fermentation vat that they have, there's also things that can happen in there. But basically, this is just to show you that, a colic is not a colic is not a colic. There's lots of different things, and our job is to try and figure out what is happening so we can figure out the best way to fix it. So I'm certain that we are all aware of some of the signs of a colic, which would be uncomfortable horse, pawing, looking at their belly, rolling. Sometimes I would say the most common thing, and obviously doctors chime in if you think something different. I feel like we get a lot of calls just when horses don't eat their dinner the way they normally do, and that's the first sign of colic, which is great because nobody wants to wait until their horse is, visibly distressed. So again, knowing what's normal for your horse. Do they normally like hoover all their food in 2 seconds, or do they take their time and eat all day? Like, those are the things that can help you determine what your horse is doing. So you go out, you think your horse is colicking, take their heart rate, since you know how. That's a really important piece of information. Remove all the food. Just because horses want to eat doesn't mean that they should be eating. So if you think that they're colicking, you're never wrong to pull away any of their snacks. If the horse is extremely painful, which I hope is never the case when they're on the ground and they're rolling and thrashing, yes, we don't really want them doing that, but we also don't want our clients putting themselves in danger of getting smashed by a rolling horse. So just use your judgment as far as that goes if something really is happening. Obviously call the vet as soon as you think there's a problem. The sooner you call us, the sooner we can chat with you and develop a plan and then get on the road to go where we need to go. I would prefer people don't give any medications until they talk to me. I am certain that everybody probably agrees with me. You know, and we are always here, so like it's not that hard to just call. Let's see, and this is something that I would say is really important, is having a plan for an emergency situation before you actually need to have that information. So if your horse is insured, make sure you know where that information is and you know what you're supposed to do with it. Have a budget. You know, nobody really wants to think about it, but the time to decide if you're going to send a horse to colic surgery, you should have in your head, yes, I can spend $6,000 to $9,000 on this, or no, I can't, before that's a question that has to be asked. And then also have a plan as far as trailering or who you can call to help you besides the veterinarian. If you need help loading the horse or keeping an eye on it overnight, and just, you know, just like any other emergency plan, think about the things you don't want to think about before you have to think about them. These are just a couple of pictures. That's Kelly listening to gut sounds. And then on the bottom, you can see, if you look closely, that horse has a nasogastric tube. And so somebody's refluxing that horse to try and get stomach fluid off of their stomach. Horses can't throw up. So if they start building up fluid in their stomach, it can be quite an acute and deadly problem for sure. Kelly, I can't see the chat window. So if there is a question that I need to answer, just let me know. Okay, you call us out for a colic. What are we going to do? We're going to do a general physical. We are probably going to do a rectal exam. Obviously, you know, our arm is like this long, and horses, you know, some are tiny and some are huge, but it can give us a good feel of, you know, certain things we're looking for. As far as, can we feel an impaction? Is there lots of gas distension? Certain organs are supposed to be in certain places, and sometimes we can tell if they're moving. So the rectal exam can be a really important part of a colic, depending on how severe it is. Passing a nasogastric tube is another thing that we often do. That is number one, to check for reflux and see if that horse is building up fluid on their stomach. And then also, it's the fastest and easiest way to rehydrate a horse. So again, like I said, a lot of times they get impactions, which is some dry manure that's getting kind of stuck moving through. But the nasogastric tube is the fastest, easiest way to hydrate that mass of manure and get it moving, give electrolytes, that kind of thing. I've got on here the abdominocentesis, which is a fancy word for belly tap, to look at the fluid surrounding the intestines, and an ultrasound. So those are both things that we do not do on every colic. Sometimes we do them when we want more information, and sometimes that is something that they will do at the hospital. So that just kind of depends. Those are sort of further down our diagnostic tree as far as what we like to do. Then obviously the question is, how do we get this horse comfortable? So there's a couple different classes of drugs that we typically use. Mostly we use non-steroidals like Banamine to do some pain relief. A lot of times we'll give some sedation that'll get their heart rate down and also has some pain relieving capabilities. And then there's some drugs called antispasmodics, which I call like anti-Taco Bell stomach. So like when they're crampy and everything is like gurgling, it kind of calms it down. So there's, you know, hopefully this is not a question, but, you know, sometimes horses do need to go to a hospital, whether it is for more intensive diagnostics or more intensive care than we can do on the field. And sometimes there are horses that do need surgery to relieve their colic. So that is the thing, you know, I feel as a primary care veterinarian, my job is to decide, number one, does this horse need to go somewhere else, or can we manage it on the farm? And if we're going to stay, then we can get to work. But again, this is the kind of thing to have in the back of your head before we are standing there next to your horse talking about it. Like, know what hospital you would go to and how you would get there. As far as surgery, colic surgery can sound really, really scary. However, horses that go to surgery sooner usually have really good survival rates depending on the problem. I would say when I worked in the hospital, the things we had a lot of trouble with were the horses that people waited and waited as a last resort to go to surgery, and then the horse is more compromised and things were a lot tougher. So again, that's why being able to find the problem and know exactly what you would do about it is really important, because then you're not sitting there for a couple of days hemming and hawing and potentially making your outcome less desirable. But you can see some numbers here. I would say the number that I feel is super important is the fact that 78.5% of horses that discharge the hospital after colic surgery, so 75% of horses go home, and most of those, almost 80%, return to their previous level of work or higher. So it is definitely not a career ender. It's not, you know, it'll put a pause on your year for sure, but there's nothing to say that horses cannot go back to work after having a colic surgery. There was another study that came out that basically said that horses in their late 20s and early 30s also had pretty good survival numbers. And I will say, I am certain that those cases were selected carefully, because nobody is going to, if there's a horse with lots of other concurrent problems, you would probably not take it to surgery. But just know that there are options, and we can do a lot of good things at the hospital. So this is a picture of them doing a belly tap, which basically involves either sticking a needle or a teat cannula into the abdomen to sample that fluid. And then that's another picture of doing an abdominal ultrasound. I think they're looking on the left side of the horse. They're probably looking for a kidney. After a colic, it depends on the type of colic, how you're going to refeed and get that horse back to normal. So obviously that's a case-by-case situation, but essentially, you know, everyone wants to know, well, how do I prevent colic? And the answer is, you know, just make good choices. Like, don't get a new feed and then just abruptly switch. You want to do slow feed changes. Even when you're changing hay, you know, be careful with that. Sometimes like super green hay will make them gassy. And if you just throw a bunch of new stuff in there, try and mix it together for a couple of days. Water, hydration, obviously, you know, plenty of fresh water all the time, electrolytes and salt as needed to keep your horse drinking, especially if they're working hard or in the summer. Anything else, doctors, to add to that? Okay. That is a horse that is happy because she's finally pooping comfortably, and she wants everyone to know that she feels better. Oh, these are cool. So these are some pictures of horse after colic surgery. And if you look on the top right corner of your screen, you can see that's the incision. They staple shut, and then underneath is sort of how we keep it covered with a bandage tie down. And then a belly band to keep everything kind of tight, nice and clean while that horse is recovering. Choke, I think, was that our hilarious question, Kelly?
It was.
True or false, you can perform the Heimlich maneuver on a horse? Anybody? No, Gary, you're not laughing. Okay, so choke in a horse is different than choke in a person. So when we choke, that means there's a blockage in our trachea, so we cannot breathe. In a horse, when they choke, they actually have food stuck in their esophagus. So what happens is something's blocking their esophagus, so they start building up saliva and they keep chewing and trying to swallow. And then what they start doing is coughing and retching and like sticking their neck out, and then they will have saliva and maybe some food material coming out their food and nose, and it looks very dramatic and is very messy. But just remember that they can still breathe. So yes, this is an emergency, but they can still breathe because it's their esophagus. So like, yes, you need to call the vet, but like they are really just gonna snot a bunch of food all over you while you wait for us to get there. I mean, it's true. It's like the messiest emergency. So while you wait for the vet, you know, just try and hang tight and not panic. Like the horse will be coughing and it will be dramatic, but they'll be okay. Essentially what we will do is we will come out, we will try and determine what the horse is choked on, and where. Is it up high, sort of right behind their throat? Is it down low, right at the entrance to the stomach? And then this involves passing a tube and potentially lavaging or pushing or trying to figure out how to get the blockage resolved. I would say, and I would love to know you guys' opinions, I would say the most common thing that I see horses choke on is horses that are on a pellet, such as some sort of senior feed, and then they bolt it and they eat it too fast, and then they get a giant ball of equine senior, and then they drink water, and then it expands in their throat. So, you know, if your horse is one of those, maybe putting like a giant rock inside of his feed tub so he has to eat just a tiny bit slower can be a good option. The other most important thing to do is regular dental care. Horses that have, you know, lots of hooks and ramps and all sorts of weird things and cannot chew their food appropriately are more at risk for choking. And then as far as follow-up care for a choke, obviously we want to know why that happened and try and prevent it again. But sometimes we do put the horses on antibiotics because they are at risk of a little bit of aspiration pneumonia while they are coughing and breathing all that saliva and food material. So one of those things that is case dependent for sure. Anyone else have anything to add on that before we move on? Nope. Okay.
I would just add a couple other things I've seen horses choke on that I never really used to pay much attention to would be hay cubes. If people don't soak them, I've definitely seen a few horses choke on just dry old hay cubes, and just like you said, Cara, with the pellets, they absorb moisture and expand, and it becomes a nightmare in their esophagus. And then big pieces of apple and big pieces of carrot are the other things I never really used to worry much about, and then saw horses choke on them. So now I'm a little bit more cognizant of how big of pieces I'm feeding.
True story. Those are good points. Yeah, I forgot about hay cubes. Those can be annoying.
I might also give a what not to do, and a what not to do would be don't try to force flush their mouth out with a garden hose. I think the best thing that you can do is just try to keep the horse quiet, calm, keep their head as low as possible. But forcing any other materials just increases the risk of them aspirating it. So as much as you'd like to help, don't stick the garden hose and start flushing their mouth out.
Yep, good point for sure. Okay, so this is a picture actually. Sometimes we will use the scope to actually go and look and see what horses have choked on. So this is just a picture of them scoping a horse for whatever reason, whatever he was doing. It looks messy with that pile of shavings trying to catch a bunch of water at the bottom. And there's a naughty pony trying to steal whole apples from Sue. Bad. Okay, eyes. This one is really, ooh, Gary, did you have something to say? I see your mouth.
I'm just going to add from the senior member of the team. When I first got out of school, chokes were associated with 911 and get in your truck and go immediately. Somewhere along my illustrious career, somebody dope slapped me and said, it's not always that big of a deal. So just to let clients know, you might get a response by someone who says, take the horse away from food, tie it up to the wall where it can't get to food and water, leave the lead rope long enough that it can lower its head and cough, and I'll call you back in 20 minutes. Mm-hmm. And at least from my own perspective, I don't think that's an inappropriate response. And I found over the years that a very large percentage of horses will recover spontaneously. Now, there's some after steps about refeeding and stuff that should be discussed once it's established if the horse has gotten better or not. So it's not just a do this and good night, but something to consider.
Yeah, I would agree. A lot of chokes do resolve on their own. You know, I do remember in my internship saying, if it's a choke, just drive slowly. A lot of times it'll fix itself. But I would then also just say the horse still needs to be checked out for risk of aspiration pneumonia and then figure out why it's choking. But yeah, I agree. I mean, it looks really dramatic, but is certainly, like, it's one of those emergencies where I say, like, okay, I'm going to finish my dinner and put on my pants and I'll be right there, instead of like leaving my dinner and like running to put my pants on kind of situation. Okay, eyeballs. Eyes are super easy if you're a client. If you think something's wrong with your horse's eye, you should call us. Mostly the reason for that is there's a couple of different things that can be pretty serious, and there are no good over-the-counter treatments for eyes. The medications that we use for eyes are very specific, and if we use the wrong thing, it can get messy. So if you notice that your horse has any sort of squinting, tearing, swelling, discharge, whether it's like a copious amount of clear or any kind of white chunky, like in that bottom right picture, anything like that, cloudiness on the cornea as in the middle picture, those would be reasons to call us out for sure. Sometimes if you're not sure if your horse's eye is painful, if you look at them from straight on and look at how their eyelids are sitting, their eyelids should be the same on both eyes, but sometimes if the horse has a painful eye, one of the eyelids will be pointing more toward the ground, and that might be the only thing that you see. So when in doubt, call us out on an eyeball, because, excuse me, there's just some weird things that horses can do to themselves. So essentially we'll evaluate, try and figure out what's going on, but something that we will, you know, probably 98.5% of the time always do is stain the eye, which is where this dye that's bright green that you see will stick to the cornea if the cornea is disrupted. So that tells us if there is an abrasion on the surface of the cornea, an ulcer as we say, or not. And that is a very important distinction for us as far as choosing medications. And I mean, it's kind of cool. It looks like that Ghostbuster stuff. What is it? Ectoplasma or something. Anyway, so that's a thing about eyes. This is a picture. I don't know who fixed this eye up because this was before my time, but obviously a laceration on the eyelid is important and needs to get looked at to see about the integrity of the eyeball. And I would say, obviously, doctors, whatever you think as well, but you know, if horses leave things alone, they usually heal really nicely. So the key is to keep the horse from making things worse. Oh, this is cool. So this is checking the pressures, the ocular pressure of the eye. Horses can get, there's glaucoma, which would be an increase in intraocular pressure. And then in horses, actually more commonly is uveitis, which would cause a decrease in pressure. And that's sort of a chronic condition, but that is a picture of the device that measures the pressures in the eyeball. The take home for the eye medicine or the eye stuff is, you know, always call us if you have a question, if you think there's a problem with your horse's eye. If you have old eye ointment from anything else, I would caution you to read that tube very, very carefully and think twice before reusing it on something. There are pretty serious contraindications for using steroids in an eye with an ulcer. So if you are not completely sure that horse doesn't have an ulcer, which can be a tiny pinpoint thing that we can only see with that dye in the light, I would not put anything in it. We will usually put the horse on some sort of oral pain medicine if they are pretty uncomfortable. And then prevention, of course, is, you know, please take a look at your buckets and your hooks and all the things in your barn where a horse could catch their eyeball, you know, like we saw that bay horse in that other picture. Fly masks, I think, are a case-by-case basis, because I have seen horses that live outside with a fly mask and no one looks under it for several days, and then there's like a big problem. And sometimes it can make them itchier. So that's definitely, unless someone else has something to add, I would say a case-by-case basis as far as that goes. Acute lameness. So acute meaning immediate onset and not something that's been going on for weeks at a time. So your horse comes in from the field and he's hopping, you know, just toe touching on his front leg. So the first thing you're going to do is look for any big obvious swelling, like did something happen? Is there a trauma? And then the next thing I would suggest is checking the digital pulses, which I did actually kind of rush through that, but it's on that diagram. If you have it on the side of their fetlocks, you can feel, if you just put your hands there, there's a little band with veins in it and arteries, and you can feel. You have to be zen, because in a normal horse, you can't always feel it. And obviously, whoever's listening, Marianne or Tori or Sue, we can always show you this next time we see you. But digital pulses are a really good way to get an idea of if the horse is footsore. Does anybody know one of the most common reasons for acute onset lameness in a horse in their foot that's not a doctor?
A rock.
That'll do it. Yeah, exactly. So a rock, a stone bruise, an abscess, all of those things are sort of in the same family of like foot traumas. So exactly. So yeah, so it's probably not broken, but you still probably want to call us to have it out to look at it. While you're waiting, definitely feel free to put the horse in a stall while you wait on us. So 90% of horse lamenesses actually occur in the foot. So most of the time it's not going to be, we're always going to check the foot first. Like, that's just the only time that you don't do that is when it will be the foot for sure. So like Marianne said, rock, stone bruise, those can turn into abscesses. Those are all the things that we are looking for.
Some other good comments in the chat about potentially a loose shoe.
Oh,
maybe
yeah.
a nail in the foot.
Yes. Oh, I wish we had those pictures that Kelly had. Remember that one horse got his shoe loose and stuck it in his cornet band?
Yeah, I wish I could show that on here right now.
Yeah, horses can do some crazy things, but hopefully most of the time it is just an abscess. So on this one, you can see where we've dug out, and you can see some of that sole bruising, and you can see, and essentially if you've never had a horse with a foot abscess or a stone bruise before, like imagine like when you used to get zits all the time, except it's under your fingernail in your hoof capsule and it just hurts really bad. So that's why they are so sore and so painful. So treatments for abscesses and stone bruises are essentially anti-inflammatories for pain. Some people like to soak their feet in Epsom salts. Some people like me are big fans of the animal Intex pads, which essentially have Epsom salts in it, and you wrap the foot in it, and it's a constant pull to try and pull out the stuff that's in it. There's lots of different options, but essentially we want to soften the foot and get out the abscess or the bruise or whatever. Does anyone have any questions on abscesses before we move on? And again, I can't see the chat, so Kelly, you'll just have to tell me. Okay. So we're going to move on to laminitis, which is another condition in the foot that we can often see showing up very acutely, more often at certain times of year, maybe when horses are out on super green grass. But essentially what laminitis is inflammation of the sensitive tissues of the foot. So if you imagine the horse's coffin bone is suspended in the hoof wall, and it's attached in the front by little tiny blood vessels that interdigitate. And those are the sensitive tissues that get inflamed and angry in an episode of laminitis. And so you see this poor little pony and this other little horse, they are both rocking backwards on their feet and keeping their weight on their heels. And that is to take the pressure off the front and sides of their foot where these little blood vessels are inflamed and angry. In a laminitis horse, like you will definitely feel, they're gonna want to shuffle. They're not gonna want to walk. They're gonna be pretty sad if it's pretty obvious. We do see some more of what we call subclinical cases. That's sort of a little bit of a different discussion. But these horses that you see here are pretty obviously painful. There's a lot of causes of laminitis, and I will say that it is one of the most studied equine medicine things right now, because there's a lot we don't understand about it. But we do know that excess carbohydrates can cause them to have a laminitic episode. We do know that obese horses with certain body types are more likely to get laminitis. And then we also know that we can call it a road founder, or basically like a chronic just like almost an overuse on the hoof can also cause founder, so trauma to the foot. So lots of reasons. It can come on acutely and you might see it overnight. It also can be a chronic situation. So again, very horse specific, but these pictures are typical of what a severe case looks like when it is happening. Are we getting questions, Kelly? Okay.
I was able to add the photos of the shoe and the foot case.
Oh, good. Where are those? Can I see them? My mouse disappeared, so I can't like do anything.
Wiana is asking about overuse of medications with laminitis.
So that is definitely, and obviously doctors like, it depends what you think. And I guess my question would be, what's overuse and what medication? Because I feel like there's a lot of different things that people will try and will use, because we, again, I do think sometimes we do a little bit of a shotgun approach because we don't know a lot about the condition all the time. And the ultimate goal is to remove the inciting factor of why that horse is foundering. Like if he's foundering because he's out on 3 feet of fresh green grass, he needs to come inside. Like he can't stay there. And then you can sort of address the anti-inflammatory cascade to try and get the inflammation under control. So I'm certain that didn't answer your question, but hopefully maybe made you think that it's more complicated. I don't know.
I think one common medication that gets a lot of flack, or there's a lot of worry and knowledge about, is the use of steroids and potential onset of laminitis. And there are certainly studies that show that it can result in laminitic episodes, and there are studies that show that even at multiple, double dosing, triple dosing, no laminitic episodes were caused with that excess dosing. So there's kind of studies on either end. What I would say, and I know that Doctors Matheny and Moding had a recent case where we had a horse that actually had Cushing's disease, and that results in excess cortisol in the horse's system anyway. And so I think more than anything, not necessarily what we give, but what the horse is producing themselves can result in those laminitic episodes, and is worthy of more discussion with the veterinarian before administration of steroids.
Agreed. Good answer. Thank you for clarifying that. So just quickly on this picture, we will always take x-rays of a horse that we think is having a laminitic episode, because we want to see the position of that coffin bone, which is the triangle shaped bone at the bottom of the foot in the hoof wall. And if that's something anyone wants to discuss more, we can certainly do that together, looking at some pictures later. Any other questions about laminitis before we move on?
There was a clarifying question regarding the continued use of Banamine, so continued use of a non-steroidal anti-inflammatory drug. I responded in the chat that would more likely result in GI issues like gastric ulceration. I don't have any sense of it resulting in laminitic issues, and as a matter of fact, it's oftentimes used as a pain reliever in those cases.
Yeah, and I think there were those studies, we kind of talk about the anti-endotoxic dose of Banamine. Using it in a smaller dose more often can actually mitigate some of the effects of the toxins that are released when there is a carbohydrate overload or a colitis or something. So Banamine actually is a pretty versatile drug in that case. Okay, cool. So lacerations. I think this is our last little bit, and then we'll definitely have a couple moments for questions. But essentially lacerations could be anything from just a little abrasion through the skin to like a big honking gaping wound. And so I think we just have here a couple of pictures and then a bunch of words, but essentially if it's deeper than the skin or close to a joint, we definitely want to get a phone call. I would always rather talk to someone and see a picture of something and then say, no, I think it's okay, or yeah, I should come see it, rather than get a call like 3 or 5 days later about something that we could have cleaned and closed up and let it heal really nicely, and then gets kind of a mess. So I would also say for sure, like, keep it clean. If something happens, like, you can hose it off, no big deal. Cover it with a clean towel or a diaper or something until we get there. If there's something sticking out of it, like the picture that Kelly, I don't know where you posted it in the chat or something, is that what you did? Just leave it there. Like, we do like to take x-rays sometimes and see exactly where something is sitting, if there's something stuck inside, like, a stick or something like that, or a nail in a foot or anything of that nature. And then obviously tetanus is real. I saw a horse with it in Florida. He was unvaccinated and lived outside. I never actually found a cut on him, but he definitely had tetanus. So please be sure to keep your horses up to date on their vaccines as far as that goes. So this is a little diagram of like important places. So if there's a cut around any of those, give us a call for sure. unless it really is just an abrasion on the skin. Anything other than that, we really should probably take a look. What we don't ever want is an open synovial structure that has a chance to get infected. So I would also argue those are synovial joints. Also, anything on the back of the leg near a tendon, for sure, give us a call. That's not highlighted on this, but I guess really, if it's not on the body of the horse, just call us. We will always look at pictures and have a chat with you. Better be safe. When we arrive, we will clip it, clean it, block it, close it if we can. Some wounds are not really great candidates for closure. So sometimes we won't, depending on where it is, how much skin is left, how contaminated it is. It's definitely a case-by-case basis. But, you know, essentially we just want the best outcome for the horse. And I would also say to everybody, horses generally heal really, really well if you keep stuff clean. And if it's on a lower leg, we have to keep the horse still, but they're good at healing. So a lot of times really good wound care, you'll be just fine. There's pictures of some instruments. Kelly's working hard. Kelly.
We have an open question for everybody on additional signs of tetanus problems. What are clinical signs of a horse with tetanus?
So the only one I've ever seen was down on the ground with its legs straight out and its third eyelid and eyeballs rolling back in its head. So it was very extreme. And I am certain that nobody on this webinar has a horse that is at high risk of tetanus. Has anyone else seen it? Gary, you've seen it probably, huh? You're muted. Oh,
I have seen it. My own father's horse had it when I was a kid. He survived, the horse and my dad. The horse had a very rigid sawhorse stance, had inability to chew food, hence the name lockjaw. I don't remember, but I was probably 7 years old at the time, if the horse had the third eyelid, the nictitating membrane, prolapsing, partially covering the eye itself. And I saw one during an internship. We thought was tetanus, it turned out to be rabies, and that horse was recumbent. So they can be kind of confusing in that crossing over to other severe neurologic.
Yeah, I don't think I would pick either one of them really, but.
I mean, the good news is that as part of our normal deworming and vaccination protocol, we vaccinate for tetanus once a year. We will have a conversation with you when we're there if there is a laceration, that if it's been over 6 months since the last vaccine, we will recommend a booster. So it's an annual vaccine, but a booster if there is a deep laceration that happens outside of that window.
Yep.
Yeah, apparently the horse is exquisitely sensitive to the tetanus the tetanus toxin, so their need for good immunization is higher than probably a lot of other animals. Right. Most people would question, you know, I only get a tetanus shot every 10 years. What's the big deal? Well, many things, including that difference in immune response, but also we're a lot cleaner than horses, and we generally know when we've suffered a puncture wound and what to do about it. So
exactly. So this is more pictures of Kelly doing handiwork. Beautiful, good work, looks great. And I think that's it for our super fast presentation on physical exams and common emergencies. So let's open it up to questions that you're getting through the chat window, or anyone who wants to just put their mic on. Let's chat. Nope.
I don't see any questions in the chat just yet, but please, everybody, don't hesitate to pop on and interrupt me. I was going to just take a moment while we have a captive audience just to reiterate what we are doing with, you know, the situation of the elephant in the room being COVID-19. We are still business as usual in the sense that we are available should you need anything, but the practice has initiated quite a few biosecurity practices to try and keep ourselves safe and keep you safe. We've created 2 separate teams among the entire group to try to basically have a means of quarantining a set if anybody becomes sick, but still being able to provide continued care for you. So we had a little conversation at the beginning before everybody popped in about, is it safe to ride? And I think the answer is it's safe to do most things if you can control your exposure to other people who might not be practicing as good of sanitization of their hands and body as you. And really, I think the most important thing is, when you're at the barn, no shared brushes, buckets to clean your tack, bridles, that type of thing. Those are all potential surfaces that hold not just COVID, but the flu, bacteria, all of the above. So please obviously be respectful of whatever the barn management is asking of you. But I think I'm of the opinion that if you can kind of keep yourself protected and use good sanitization practices, it's still safe to go and ride. So Chelsea's asking, do you commonly see proud flesh in distal limb injuries, and what are the best ways to avoid it? Great question.
Yeah, super good question. Ouch. Does anyone else want to answer a question while I keep talking? Yeah, so proud flesh, for anybody that doesn't know, is basically, so when a wound heals, it makes what's called granulation tissue, which is healthy pink tissue that grows and then enables skin to grow over it. And because horses are really good at healing, they also they can make excess of this granulation tissue, which is what Chelsea's referring to as proud flesh. And I would say that in my experience, the best way to keep proud flesh from happening, which basically is just extra healing tissue that's coming out of the margins of a wound. And the problem with that is that skin has to have a flat surface to grow over. So if there is some sort of inside tissue blocking the way, it can't keep going. So distal limb wounds, especially that we can't close with sutures, will keep bandaged. Keeping pressure on it and keeping it in that fashion can be really helpful with proud flesh. And then I would also caution, there's a lot of products that you can buy at the tack store on Valley Vet that quote treat proud flesh, but a lot of them actually are toxic. Like they treat the proud flesh because they kill all the cells. So then you're also killing the healing cells. So, so yes, it can be a problem, but it can be well managed with certain ointments, such as a steroid can be really good, and keeping things bandaged. I would love to know if anyone else has an addition to that.
I think if you're in a pinch, some things that I've seen, especially like in school when we were in Southwest Virginia, was like a sugardine. So just like a betadine solution and sugar over the wrap can be super helpful. The fancy version of that for those of us in Northern California is Manuka honey. Yeah. And I've also, though I'm not recommending it, I've also seen people use meat tenderizer to reduce granulation tissue. So I guess that's just to use an example and say that people will recommend everything under the sun, but sometimes less is more, and just like a really healthy wrap, just like Dr. Wright said, is the best way to go. We have another question. How do you know if a horse has scratches?
So for anyone who doesn't know, scratches is sort of the layman's term for dermatitis on the distal limb, usually around the pastern area. And essentially it can look anything from sort of just like bumpy hair to actual like red kind of weeping wounds and some scabs. So I would say if your horse has anything weird sort of down low on the back of its pasterns, that kind of area, and is sensitive, then it would be worth a discussion.
Supplies to have at the horse show.
I would say you always want to have a thermometer, a stethoscope, some wrap materials, so just like big fat pillow wraps, a nonstick pad, you know, I think depending on the relationship you have with the vet and how comfortable you are, having some bute or some Banamine is usually okay as long as you are well versed in the dosing and how to use it. I don't know, what else, guys?
I would add making sure that those supplies that you're storing are in the truck with you and not in the trailer. We had the opportunity to talk about that at a recent disaster preparedness seminar in the East Bay, and I have unfortunately seen trailer accidents where the door to the tack room is inaccessible, and so having access to your supplies right there with you is just a simple step that you can take to make sure that you can actually reach what you need.
For sure.
I would just also add too, you know, most of the shows are going to have a vet on site that's available. We can be called first. Or if you are perhaps going somewhere further out than a show, like camping, and you're not going to have access to even phone, that's a whole different situation that we might want to prep you for differently in advance.
Good point. Two more great questions. One of them, I want to address this one first. Perhaps we can all discuss how we'd like horses presented to us when we're going out to the farms, especially while we're in this sort of shelter in place period. And how are we keeping a social distance, or how are we requesting that our owners do that? And that's a great question, and thank you for being aware of it. I can kind of speak, and I'd love the doctors to step in. First and foremost, we are available and going to our visits with an assistant so that they can handle the horses if you are not available, if you do not feel safe going to the barn or are sick, please don't come to the barn. We have assistants so we can safely complete the exams and then FaceTime with you or touch base with you in real time while we're taking care of your horse. With regard to handling the lead rope, when I was at appointments today, I was lucky enough to have an owner who did the handling for me. And so I actually didn't ever touch any of the things that she was handling. I was just able to work with the horse. So that's, you know, one way that we're doing it is just first and foremost, we're not going to come to you if we're sick. So please don't meet us if you are. And then we kind of are doing as much as we can with the horse without handling any non-Starwood supplies. Anything to add to that?
No, thank you for whoever asked that question.
Yeah, thanks for keeping everybody safe for sure. An additional question, what fruits or treats should a horse not eat?
I mean, I feel like that could go a lot of ways, right? I would say just don't feed your horse giant chunks of things that they can't chew and swallow appropriately. And then obviously if your horse is at risk of equine metabolic syndrome or laminitis or that kind of thing, then you want to keep the sugar level down. So, you know, not a bunch of horse cookies with a bunch of molasses and stuff in them. But like my horse used to eat hot dogs. So like horses are weird. Like, what are you going to do? Anything else?
Any other questions? Thanks for joining. So we'll look forward to seeing everybody on the 25th. And if there's topics that you don't see posted that you'd like us to cover, please don't hesitate to reach out to the office and we'll get something together.